What do you reckon the government should have done in order to address the skepticism behind, say, vaccines, even the pandemic itself, man? Because the fake pandemic shit has just ground me into a little ball of lint.
Yeah. So it started off with, this isn't real because no one ever saw a COVID positive patient. It's because we didn't have much COVID in Australia.
Yeah.
I mean, we only had like a handful in hospital at the start, right? And then that sort of changed, and then it was, all right, yeah, COVID's, because everyone knows, by now everybody knows somebody who's had COVID.
Yeah.
And everyone usually knows someone who got really unwell with COVID. And then it sort of changed. It's like, no, the vaccine's a conspiracy because, we haven't really gotten to that. In other countries, we are seeing people who are vaccinated still require hospitalization. And there's a couple of reasons behind that. I mean, one, if you've got 90% of a country vaccinated, the only people who are going to be going to, it's just a numbers thing, right?
Yeah.
It's like the people that are going to be going into hospital are going to be vaccinated because, they make up the majority of the people who are in the population.
Yeah.
But then if you look at the numbers of people in the hospital, you'll find that it's disproportionate in terms of the actual population. So, you might see a 50-50 mix of people, but when 90% of the population is vaccinated, so that 10% will be making up 50% of the people. And this is I'm just, throwing out some numbers, but that's what the statistics are showing as well.
Over the last 2 years, I've heard every pushback against COVID, from it being a conspiracy to then the vaccines doing damage to then every sort of all the way through. The one that sort of gets me a lot is, okay, it exists, but I don't believe that it's doing what people are saying it's going to do.
Yeah.
Or being something that people aren't going to recover from.
Yep. And that's because we respect our patients' privacy and confidentiality.
Yeah. And
you can't just walk through an ICU and have a doctor tell you someone's complete history from start to finish. Because if that were the case, I can assure you that there would be a lot of people that would change their mind.
Really?
Yeah, 100%. Because it's when you sit in there and you find out someone's 45 or 55 and they have absolutely no hope. Their lungs are completely scarred. They're on the maximum amount of pressure they can tolerate without bursting a lung, and they are not on 21% oxygen room air, or aka room air. They're on 100% oxygen. There is nothing higher than that. They cannot get more. They cannot ventilate their lungs any better than what we're doing, and they've got, I don't know, you and I are sitting here, we've got oxygen saturations of, I would assume, over 98%.
Yep.
Right? 100% probably. You don't smoke?
No.
Good. All right, so 100%, 100%. These guys will be sitting there with 70 to 80% on maximum therapy.
They're getting oxygen pumped into them, and they still can't.
They've gotten it pumped into them, yes, that's right. And if they were getting pumped any harder, they would burst their lungs.
Yeah.
They'd end up with a pneumothorax or something. And they are not maintaining oxygen saturations that could allow them to do anything. They're comatose.
What about all the reports of how people were saying that more people die from the flu every year, yada yada yada?
Oh, so if you look at I think last year I looked at some stats, and I don't recall the numbers exactly, but you looked at the amount of people that died from the flu in the previous year versus the amount of people that died from COVID last year, when we didn't really go through we didn't go through a wave, and we were in stage 4 lockdown for a majority of the year, right?
Yeah, we didn't go outside, man.
Yeah, exactly. And COVID still killed more people than the flu. So I don't know, it's wrong. COVID still killed more people while we're in stage 4 lockdown. And people talked about how low the rate of the flu was. It's oh, we don't hear the flu anymore. What's this? This is just this is another conspiracy. It's we didn't hear about the flu because people weren't in closed rooms, not wearing a mask. So
I went to my GP last year. Maybe it was at the start of this year or the end of last year. I can't remember when it was. Last time I went, something random, I needed a re-up on my inhaler or some shit, And I said, how's it all going anyway? He goes, look, because less people have got the flu because everyone's staying inside and they're washing their hands.
So imagine how much more contagious COVID is if it can still break through that.
Yeah. I'm just trying to think of all the spurious facts that people threw out there, and it's easy to latch onto because, you know.
Oh, so I can I can talk about one other thing, because I hear this from like relatives and or distant relatives and I guess acquaintances and so on, and people will always question you because you've got a medical background. Oh, what do you think of this and what do you think of that? And I hear people. Firstly, I don't know where people are getting this idea that people are getting sick from the vaccine. I worked in emergency during the rollout of the vaccine when we had we had very low numbers of COVID. I think in Victoria we were like on 0 a day at some point for a prolonged period of time.
Yeah.
Right? Yep, donuts. That's right, donuts. And we had the vaccine being rolled out. Not going to lie again, I saw some people come into ED post-vaccination, maybe with a fever, maybe with a headache.
Some form of side effect.
Yeah, some sort of side effect that you would normally expect from a lot of vaccines anyway.
Man, when you take penicillin, they ask if you're allergic to it.
Yeah, no. An allergy is, it's a severe side effect, but it's a reaction to the medication.
Yeah.
If you get anaphylaxis, if you're allergic to it, you shouldn't have it. But that's with everything. But a lot of it was caused from the stress and the conspiracies and the media sort of stressing people out, being like, oh my God, what have I just done? I've just had this vaccine. And they get a bit anxious. They come into emergency. We run all the tests. We check for the rare blood clots that are, I think it's like 1 in a million, probably less.
Yeah.
Likely, especially now that we've adjusted the vaccine that you receive depending on your age.
Because there was no blueprint. Like, you're basically figuring it out as you go.
What do you mean?
I mean, to an extent. I mean, like you said, you're adjusting the age range of the vaccine sort of thing.
Yeah, so there's a lot of controversy about the fact that we did adjust the age range and all that, because I think it did create some vaccine hesitancy.
Yeah.
Because when you see the government taking back what they initially did, you do become a bit more cautious, and I definitely felt that as well. But like when you actually look at the numbers and look at the research, it's
a much.
It's okay. The risk was a little bit larger, but it was still better than not getting the vaccine. It was still better than not getting the vaccine.
I think I spent a lot of time telling people that had that hesitancy, they said this, but then they said that, blah, blah, blah. I'm like, yes, because we're still figuring the fucking thing out. This is literally...
We want what's best. And like I just said, it's still better to get it than to not get it.
Yeah.
So they're just trying to make it even safer for you so that you have even less to poke at, even less to worry about.
Yeah.
And so on. And like I was saying, all these people the few people that I saw come into emergency after the vaccine rollout with a side effect, which was usually a headache or a fever, they never had a problem. They went home.
Yeah, it wasn't.
I did not see anyone get intubated in ICU because they got the vaccine for COVID.
Yeah.
Like I didn't see anyone. I don't know if there's any cases maybe there's a case report or something, but I can tell you now, I personally have not seen them, and I can tell you now that more people have gotten the vaccine than have gotten COVID in Australia. And, well, what do you know? We've got a lot of people with COVID in the hospital. We don't have a lot of people. I think we have nobody in the hospital who's had a vaccine side effect.
Literally.
Or no one that I've seen.
Life-threatening sort of side effect.
Life-threatening side effect. We have people who have come in, we've scanned their brain and so on, because, there's this worry about this blood clot and a couple of other issues. I know myocarditis is something that's been worried about a lot with the Pfizer vaccine in young men.
Myocarditis being what exactly?
Oh, inflammation of the heart.
Okay.
Myocarditis, pericarditis, and yeah.
Yeah.
But, I mean, the risk of getting that is far lower than contracting COVID and becoming pretty unwell.
I think out of everything, like all the conspiracy things and all the shit that people throw around, I think the one that really triggered me, I'm not a doctor, but I know what the Hippocratic Oath is. And I remember hearing from a bunch of people about how their GP was like refusing to allow for fucking jabs and spreading misinformation on their end. How does it make you feel?
I did hear some stories like that. And it's worrying because, I mean, your GP is usually someone you've developed very good rapport with, someone you trust. It's your person managing your medical problems. And when you hear people, or you hear that a GP has, and not, there's probably very few GPs that have done this.
Yeah.
When you hear something like that's happened, you don't feel right about it, because you're like, oh, maybe they haven't worked in the hospital. Maybe the community that they're serving hasn't had a big outbreak of COVID and become severely unwell, and maybe that's where it's come from. Because I can tell you now, if they went into one of the hospitals, one of the big Melbourne hospitals, during the peak of COVID, they would say otherwise.
Is the stream of information the same for, say, the GPs out in the boonies or your local burbs, as opposed to, say, a doctor in
the hospital?
Yeah.
So I think the difference is we're exposed to different medical problems. They're exposed to people in the community. We're exposed to people who need hospital admission. And usually people that need hospital admission are very unwell.
So in regards to, say, info about COVID and all the stats. Oh,
I get what you mean. Yeah, no, they have the same. They have the same
rollout.
They have the same access. And one other thing that I wanted to bring out about this is people are very biased, and when you hear that a GP has potentially told a patient that they should maybe avoid getting the vaccine, usually I feel like it may not be the case. I feel like there's a personal bias there, and they are selective with the information that they hear from their GP.
Yeah.
So possibly the GP has said, look, there are these risks associated with the vaccine. I've got to let you know about them. And potentially the patient has been like, my GP's told me not to do it.
Yeah.
They've latched on what they want to hear. Yeah, exactly. And they've forgotten the rest of it, which is this can save your life.
Yeah, it serves their narrative or whatever it is, and that's all it is.
And, we're all guilty of doing something like that in some way.
The idea that there are doctors out there pushing back against vaccines and the general... I personally have not met a single doctor who is against the COVID-19 vaccine. Yeah.
I'm not saying they don't exist. I'm sure they do. But I haven't met one personally, and I've met quite a few working in the hospital.
Yeah.
And usually the first thing they ask is this patient vaccinated or not? Because that will determine how much we're going to have to worry about them when they come in.
Your whole course of action regarding them. I got triggered a lot, man. Like, it's been trying for everyone, man, but especially when I heard the shit about people telling me that their GP said don't do it, blah, blah, blah.
Yeah, I think there's a lot of selective hearing there.
I've cracked it, and I've just said, getting you fucking doctor, are you fucking serious? Like,
yeah.
What? That's why I'm asking, would these doctors have the same flow of information?
No, they do. They one thing that comes to mind is the fact that sometimes as a GP I guess you're working, sometimes you could be working by yourself, you're not working with a team, and I guess when you're in a team environment, you're more likely to share information. You know what I mean? So I learn from you, you learn from me, you hear something, I hear something, I show you a statistic, you show me a study, and we sort of learn together. And obviously in a hospital, there's protocols that are followed, and, I'm getting emails probably right now about a protocol that's been updated regarding whether it be regarding COVID or what we're testing or who's turned positive and how long we have to isolate for and so on.
Yeah, constantly.
So I'm constantly getting that inflow of information, and in general, in GP land, that may be missed. But they definitely have the access to all the information as well.
How about a sensitive subject that's sort of come up now, man, which people are really hesitant to talk about, is boosters coming up.
Yeah.
What's your take on it?
It's not. I'm not going to lie. It's not something I've looked into very much, and the reason is because I trust the numbers and I trust the people that are making these recommendations.
Yeah.
And I think looking at the other countries that have gone through second waves, there's a few things that we have to consider. One being the fact that when we were comparing, so I think, for instance, let's use Israel as an example, and I don't know the exact numbers, but we'll do rough ballpark figures, right? They had the alpha strain of COVID at the start. They would have had an outbreak or whatever, and then, they got everyone vaccinated and they still saw people coming into hospital. And, if you compare the hospitalizations, it's probably still lower post-vaccination, but you're like, oh no, they're still getting hospitalized. But what we're comparing is alpha strain with no vaccine versus delta strain with vaccine. So we're not really comparing the same thing. We're comparing two different strains of a virus.
Yeah.
And then we're comparing a vaccinated and unvaccinated person. I don't think it's a very fair comparison.
No, that makes sense. Yeah.
So we are seeing, people still getting sick. We are also seeing that people after 6 months are having a waning immunity, right? So that's probably true. So I guess, sorry, what was the question about the boosters? So
with the boosters, like a lot of people are being hesitant about the idea of having to take a booster. Like we all bit the bullet, we all did our double jab,
yeah,
and now people are talking about boosters coming in. And it's like, no,
yeah.
A lot of that people that have been on the train so far are saying, nah, I'm stopping with boosters. I'm not getting jabbed again. La la la.
Yeah, I feel like those people feel like they already took a risk with their first jab.
Yeah,
and they're like, well, I've done my part. I shouldn't have to do it again.
Yeah,
and they think that it's a really big ask to get a
sorry,
third.
I just feel your frustration, man. Like
yeah.
See, you get out of this is the thing. This is why I respect people in your field, right? Purely because you get up in the morning focused on saving fucking lives, man. These people out there think they're doing God's work by doing jack shit, where doctors and especially the people on the front lines for COVID now, man, have literally spent 18 months, 2 years nearly, wearing the scrubs, wearing all the gear, round the clock monitoring people so they don't die. That's a concept that the average layperson doesn't actually understand, man, and it's frustrating. It really pisses me off because I'm seeing you're talking about this, like the stuff you're talking about, man. It's literally life or death. Like it's mortality. You're taking that responsibility on, man, and it pisses me off that people will doubt shit that you've seen with your own two eyes. Do you know what I mean?
Mm.
Like that's what's frustrating.
It's frustrating for me as well. But
I know that's what I'm saying. Like I'm channeling. You're being so diplomatic, man. But because if I was you, I'd be like Becca or some shit. I'd be losing my fucking mind every day. Do you know what I mean?
No, it's frustrating, but it's the reality. So you just do your best to make sure people are educated. Like I said, everyone that I know that was sitting on the fence, I called them up and I told them, look, this is the reason why I think you should get vaccinated.
Yeah.
And there's people that are I'm hearing about people getting exemptions, and sometimes these exemptions are for silly things.
Oh, man.
Some of the exemptions, like I'm hearing people getting exemptions for autoimmune diseases and all this other stuff. And the truth is that if you have if you've got an autoimmune disease, it may make you more likely to get very unwell with COVID. So that's you should be more inclined to get vaccinated.
Yeah. I've heard the dumbest exemptions, man, for even just wearing masks. I've got anxiety. I've got asthma. It's like, well, I've got anxiety and asthma, and I'm wearing a fucking gas mask if I have to. Do you know what I mean? And it takes the piss. You know what I mean? Like people actually taking away from people that really do have these things.
Yeah.
You know what I mean? So, look, what do you reckon moving forward? Yeah, I mean, we'd like to think we're at the tail end of it. Do you think we are? I mean, we've got the Omicron now.
Yeah, I was going to say we'll be at the tail end of it when our developing countries are fully vaccinated as well.
Yeah.
And imagine, right, we've got the privilege of having these, having a preventative strategy widely accessible and available to us. Even booster shots we have available. And, some of these developing countries, they can't even get their first shot.
Yeah.
But, that will change with time. And the sooner we address that, the less likely we are to develop mutant strains that are going to be resistant to, possibly resistant to the vaccine. So we should get on board of doing that earlier rather than later.
Yeah. Okay. What do you, how far away do you reckon we are? I mean, I'm not asking you to predict the future, but how far do you reckon we are till this is COVID's never going to go away.
Nah, it's going to stick with us. It's here. We're going to live with it.
Yeah.
And we're lucky that we avoided what a lot of countries had to go through, like Italy, like Spain.
Yeah.
And so on. in that we had the harsh lockdowns at the start. We weren't one of the first countries to be affected by it, and we got to learn a lot from other countries. Even the vaccine, we got to learn a lot from other countries because, you know, we got on board quite late.
Yeah.
So we got to see, you know, the side effects and the safety profile.
When we say, you know, we're going to live with COVID, it's the same. I feel like, you know, when people go up in arms about it, I sort of think of it like, well, we learned to live with measles, we learned to live with mumps, we learned to live with Ebola. You know what I mean?
Yeah.
I put it in that sort of bucket. Like, yeah, it's another disease that's come up that we're going to figure out how to manage.
Exactly.
Is that the best way to look at it?
Yeah. We're going to figure out how to manage it. That's the way I look at it. Everything's looking bright for us from here on. Omicron's, look, we don't know very much about Omicron. We don't know how infectious it is. We don't know how lethal it is. We don't really know its mortality rate. But those figures, that information will come with time.
Yeah.
And hopefully we'll be taking the appropriate steps to prevent it from really affecting us.
Can I ask you, Matt, like, you don't have to throw anyone under the bus specifically, but all the people that you said you were on the fence, you know, regarding vaccinations, all that sort of stuff, you caught up and had a chat with, what percentage of those people would you say jumped on?
I think a lot, but a lot of them, what made them really jump on board is the fact that it was mandated. And everyone had something to say about the well, not everyone. A lot of people had a lot to say about the mandation of the vaccine, like why we should have a choice about whether to take it or not. No, but you shouldn't have a choice about whether you're going to affect the health of other people around you, right? You know, you've got the responsibility to do the right thing. We want to develop herd immunity. We all want to, you know, reduce the risk of there being mutant strains, reduce the risk of infecting other people, not have to worry about what we might catch if we go to the supermarket, you know, to get our food for the night.
Yeah.
So with those people, although people complain about the mandate, the fact that the vaccines were mandated, it's one of the best things that's happened because I don't think we would have gotten to 90% without it.
Yeah.
So the people that were sitting on the fence I think a lot of those people became more okay with the fact that they had to get the vaccine now. Does that make sense?
Yeah.
They were more okay with the fact that now, all right, well, I have to get it, so I'll just get it anyway. Some people some people I convinced and they were happy to get it before it was mandated as well. But everyone knew it was going to become mandatory.
What do you say
everyone
about
knew early on?
All those protesters that you see in the CBD and stuff that apparently are from healthcare professions?
So they make up a very small proportion of the people in health professions, but they speak very loud.
Yeah.
So that's why we hear about them. And it's very controversial. So when they do protest, you know, it's on the news. You know about it. I know about it. It's a very small proportion. And
where do you reckon this? I mean, I've stopped listening basically, but I mean, these are essentially your peers and colleagues and stuff. So where do you think they're coming from? What's the actual argument? From anyone you know? I mean, do you know?
So I know of people who have chosen not to get the vaccine who were working within the hospital.
Yeah.
Very few people. As I mentioned, actually none of them were doctors. Some of them were PSAs, so theatre techs, people that move around move patients from site to site after surgery or whatnot. Some cleaners,
just orderlies.
Orderlies. Yep. There was a couple of nurses.
What was their reasoning?
So I heard a few of them. I heard I've got a medical condition, usually something like autoimmune or something along those lines. And look, I haven't argued it with them. It's such a sensitive topic.
Yeah.
And it's very hard to confront with them because you wonder how do you make the decision to not get vaccinated when you can literally see what's happening? But
well, it's the same reason why people smoke.
Yeah, exactly. I guess that's smoking's bad and smoking does kill, but smoking kills in years.
Yeah.
COVID kills in like 2 weeks.
Yeah. Look, people are stupid, man. Like
Yeah.
that's what it comes down to. People are stupid, 100%.
And I don't know, people, I guess it doesn't really hit that hard unless you know someone personally that's gotten really, really unwell as well.
Because it's called fear.
Yeah.
You know, once someone you know has been hospitalized, that's close to you, you know, like, man, you know, let's take a look at Greg, fit bloke, you know, early 30s, goes to the gym, blah, 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 strongest man alive, and then gets taken down by COVID. Now you're shitting yourself because you're not nearly half as fit as Greg.
Yeah, exactly. So that's,
You know what I mean?
that's one thing that comes to mind and that's what happens. Yeah, that was what was confronting for me when I saw someone that was, you know, fit and well, young, be really unwell, and you're like, oh, that could so easily be me as well.
Yeah.
But yeah, what makes you feel a bit better is I haven't seen anyone in that state who's been double vaxxed.
You say that with confidence, yeah?
Yeah. I think I said at the start when we started talking that I was a bit scared, and I was. It actually was scary, but in those times I actually remembered. I'm like, oh, wait a second, I've had both jabs. I haven't really seen anyone. You know, it's still, you know, you can still get sick, but you don't get nearly as sick.
I had a lot of arguments with people that were anti-jab because they didn't trust the science. And then I'd bring up my situation. Like I've got asthma, you know, and I've got mental health issues, anxiety. So, you know, I'm already in a heightened state. So all I need is, you know, an asthma attack to trigger me and I'm fucked. And they're like, oh, well, then you should definitely get the jab. I'm like, so hang on. So these fucked up drugs that you don't trust should definitely be on the priority for me, but not for you because you're healthy. And so many times it came from people older than me as well. I'm just like, are you joking?
Yeah. And then the other thing is, but like, you know, as someone who, you know, has asthma, I guess it looks, if you're double jabbed, even with asthma, your risk is quite low.
Yeah.
But, you know, it's still a risk.
Yeah.
And it's like, do you want to associate with someone who is more likely to pass on the virus to you, more likely to be infected, more likely to give it to you? Isn't that a little bit, it's like, it's quite selfish on their part.
Yeah.
But yeah.
And that's the whole thing. That's what I kept putting it down to, man. Like, I'd have to give you a wrap up of every episode where we've touched on this. And I've just kept saying it's because it's not what you're doing to protect yourself. It's protecting other people. And most people are just selfish idiots. And that's the reality, man. Like, I don't want to, it's a harsh reality, man, of where we're at. Like, you know what I mean?
Yeah.
I don't know. It's marketing, man. And that's what really annoys me. The fact that the government did a step back on, you know, the vaccines at some point, you know, what they should be getting and when and blah, blah, blah.
Yeah, but I can understand where they were coming from as well. They wanted to do everything.
I agree.
They wanted to do everything that, you know.
Yeah.
They wanted to be everything be as safe as possible.
Yeah.
But in the process, it did create some level of danger in that it created that, you know, that vaccine hesitancy that we were talking about.
Yeah.
So that's something that I feel like, yeah, it's hard to say whether that was a step back or a step forward.
Yeah.
But I can't speak on that.
No, look, and that's the thing. I don't expect you to speak on behalf of every doctor out there. I'm not expecting you to speak on behalf of every health practitioner or the government. You know what I mean? You can only say what you know. But that's what I really wanted to bring you down, man, because, like, most people don't have access to the information that you're bringing up.
Yeah.
You know?
I think to read the information is one thing, but to see it in front of you is another.
Yeah.
And like I said, it definitely hits harder when you see it in front of you.
Yeah.
Like when I said, when you see an ICU full of COVID positive patients that are unvaccinated.
Yeah.
And
how many people would you say you're working at, like, you know, we're talking about hospitals being at capacity. How many people would you say, like in an ICU or whatever, you know?
So this is something that people don't really realize. Like a hospital has like 10, 20 ICU beds.
Yeah.
They don't have more. Like they don't have.
No, I know.
It's a valuable resource.
Yeah.
I think people are looking at the number of people in ICU on the news like, oh, it's only 200. Mate, how many ICU beds do you think there are in Victoria? That was the best part. And like, you know, I remember actually seeing some of the statistics and being like, you know, they were high, but I was also like, I think surely it's higher because like where I'm working and the places that where my colleagues are working, they're like their ICUs are full.
Yeah. Then
I discovered, and if you look it up, you actually find out that some of the figures were actually wrong. So when they were reporting on the news and when they were reporting the statistics regarding the amount of COVID positive patients in ICU,
Yeah.
they were reporting active cases. They weren't reporting the person that was past day 20 of COVID who was no longer infectious but still on a ventilator.
So when you say active, it means that
They were able to spread it to someone else.
okay.
So if you had COVID, so if you were admitted into hospital with COVID, you became really sick and ended up in ICU, and now you're in ICU, you've been in ICU for 6 weeks, right? 6 weeks, and now you're at your 6th week. You're no longer COVID positive. You might test positive, just because of the way the virus sheds, but you can't infect somebody else. So after day 20, and I don't know if this has changed recently based on new data, but from when I last worked in ICU, after day 20, you're no longer COVID positive despite what your test says, because you can no longer infect someone else. That wasn't counted in the statistics as a COVID ICU patient. It's counted as a normal ICU patient.
Yeah.
So there was actually underreporting our stats. I feel like I went around in a circle a little bit. Does that make sense? Yeah.
And that's the other thing that annoys me, when people sort of attribute. I had a lot of people push back and say, "Oh, you know, my grandmother's painter's husband's brother died from pneumonia, but they're attributing it to COVID as a COVID death." It's like, okay, did he have pneumonia and COVID, or did he?
Yeah, maybe he had COVID pneumonia.
Maybe he had COVID and then got pneumonia because of COVID.
Yeah, no, well, the COVID leads to the pneumonia. Yeah.
Exactly. Yeah. It's all that sort of shit.
What really gets me is when people say, if you look at the death rate, like the normal death rate in the community versus the death rate in the community after vaccination, it's the same.
Yeah.
Right? But for some reason, whenever somebody dies or something happens very close to the vaccine, that's it. This is a vaccine side effect.
Yeah.
And that's pretty frustrating as well. So, like I said, the headache, the cold, and I've heard this from relatives and from family, friends, and from acquaintances and so on, where they've been like, "Oh, I got the vaccine, and then, I got sick 2 weeks later." And they were fine, but it's like, well, maybe you were going to get sick from something. Maybe you were going to get gastro anyway. You just happened, like, it's coincidence.
It's like, I got the vaccine and then bang, 2 weeks later, herpes. Like, what do you mean?
Yeah, exactly. So it's, yeah.
Do you reckon culturally there's big gaps, like, within our communities? Like, do you reckon certain cultures are gravitating towards misinformation and all that sort of shit? Like, within ethnic communities?
Yeah, I'm having a good think about that, actually.
And like I said, I'm not asking you to tar and feather anyone.
No. I think there is I think a few things tie into this. So socioeconomic status.
Yeah.
The part of Melbourne you live in. Usually the same things that tie into poor health.
Yeah.
Unfortunately. I got to say though, there's definitely a personality type that is more inclined to be an anti-vaxxer than to be like there's definitely a personality type. Like
you're just at a point now when you're at a party or something. Now that we can have parties
you can pick them out. Yeah,
you just keep your mouth shut. It's like, what do you do? Oh, I'm a painter.
No.
Why do you have doctor in front of you? Oh, it's just my initials. My first name.
No. There's you want to spread the right information. You want to spread the word. You want to make sure everyone's doing the right thing. So, as much as frustrating as it can get, you got to understand that people don't have the same background and weren't exposed to the same information and education on health. So, I can't be one to judge on that.
Yeah, no, I agree. I understand.
Like I said, we say a couple of jokes and whatnot, but yeah, it's frustrating, but yeah, it's something we've got to try to fix rather than.
Yeah, look, man. Like, I have these conversations. I was talking to a mate of mine today, just on the way in, and it was this mate of mine always brings up random shit just to throw a conversation out there, and he sent me 4 photos of canned spaghetti. I went, "Why, man?" And he goes, well, what's your experience with them? I go, I don't do them. I go, I've done canned beans because I need protein with my breakfast if I've been training or whatever. But canned spaghetti, no, as a Greek, I go, I don't touch them. And he goes, his only experience was that he was interstate for work years ago, and he got his way into a backpackers with a colleague because they'd never seen a backpackers hostel before. And he said the odious, the odious waft of like canned spaghetti drifting through the building as it was killing me. And then we started talking about shit diet and all that sort of stuff. And a lot of it comes down to just misinformation, laziness, where, like you said, economic sort of regions, like it all depends on someone's upbringing. But you can't shit can them for not knowing anything different if that's all they've known.
Yeah, exactly.
You know what I mean? So what do you reckon needs to happen now as far as educating? Like, okay, here's something. I mean, you're privileged to more information than I would be, right, in regards to COVID, statistics, all that sort of shit. Do you reckon the message the government's been putting out is accurate to what the actual ongoing situation is? Obviously, they're keeping certain cards to their chest.
I was going to say it is accurate, but it is one thing to hear the numbers, and it's another to see it in front of you and to work in that environment where it's just constantly. Yeah, you're constantly exposed to it.
I mean, I get the case count. 1,300 today. Oh yeah, cool. 6 people died.
Oh, but less people are going into hospital with it.
Yeah,
it's the hospital situation is slowly improving.
Okay, but it's been nearly 2 years.
Yeah,
basically.
Oh, but I'm talking about the hospital situation's improving from the initial wave that we were facing this year, when we were at 50% and so on.
Yeah.
As we got those rates up, look at us, we're no longer in stage 4 restrictions, and I can tell you from what I see, the hospital's definitely looking better. And these aren't admissions you can fake. Like, you can't fake needing oxygen. Like, we have objective ways of measuring your oxygen levels and
I've had to say that to
health.
People that have tried to pull up a crying wolf thing, or like, I couldn't breathe, blah, blah, blah. It's like, no, motherfucker, I couldn't breathe. That's why I was on a gas tank in a hospital. You do not have asthma. You may have a chest cold. You have the sniffles, get some Nasonex in you and you'll be breathing fine. Yeah. Nasonex is not going to help an asthmatic or someone with bronchitis. You know what I mean? Like I said, it's for people that aren't exposed to shit. They don't know, and they just take it to wherever they want in their heads. What was I going to ask you? Regarding like the whole point that we're still getting 1,300 cases a day, but people are sort of like, why are we out of lockdown when we're still getting 1,300 cases a day, et cetera, where we were literally locked down with 2 cases coming
One
in.
is the fact that we've got a very high vaccination rate, so people are less likely to get severely ill. So we're more accepting of the higher numbers. And, we want to keep safe, but, we want to continue living as well.
Yeah.
It's not good to be in lockdown for a prolonged period of time, and we've been the most lockdown city in the world. So, that's not good for people's mental health. That's not good for people economically. There's many reasons why we should be coming out of it, but we wouldn't be coming out of it unless we thought it was, was relatively safe as well. And I think
when they announce let's say 1,200 cases today, blah, 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 it's not 1,200 people going in a hospital.
No.
It's just 1,200 people
1,200 people that have tested positive.
Out of that percentage, amount of people going in a hospital would be, what? Like, say...
hard to... I haven't looked at the most recent numbers.
Yeah.
I know it's less.
Yeah.
I couldn't tell you what the actual number is.
But that's the whole point. The fact that just because you're testing positive now, it doesn't mean... Because you've been vaxxed, there's less chance you're going to need to go to hospital.
Exactly.
And that's the whole point.
Yeah.
And I think that's a narrative that the government really didn't push.
There's actually a few things there. So, yeah, one of it is actually that we are... Well, the big one is that we have a high vaccination rate. The other thing is that as we're approaching summer, people are less likely to be indoors.
Yeah.
So when you're meeting with people, with family, with friends, most of it's done,
Yeah.
doors open, better ventilation, and so on.
Yeah. I'm just picturing every Wog's house that I've gone to. They've got the heater on full bore.
Yeah,
sweating.
The doors are closed.
Sweating.
The doors are
We're in a
closed.
sauna.
Far
out, man.
I tell you what, that's what my house is like a lot of the time. Put the heater on full and just chill.
Man, I still remember. This is probably, it would have been like my late teens, maybe probably late teens, man, mid to late teens. And I still remember it being like going into the living room and my old man standing there and he's paper thin trackies, like rubbing him, like his shoulders, like, ugh. He's standing on the heater. Look, what are you doing? He's like, oh, it's freezing. I'm looking outside, the sun's out. Like, are you nuts? He's got the heater on full ball. Like, you're burning your trackies, man. Step away from the heat. Okay, what's wrong with you? He's like, oh, you know.
That's so funny.
Oh, dude, it's just, you can't help it. Like, you laugh and then you cringe and you laugh again. It's just like, whatever, man. Like, you'll all get in line one day. So, moving forward, man, like, just, we've come to this where we are at. If you could say, like, yeah, I don't want to keep you because I know, like, you're wrecked.
No, that's all good.
What is your underlying message, man? To, like, say, firstly to anti-vaxxers, literally firstly to anti-vaxxers, people that are hesitant with that sort of shit, and just moving forward, man, to in regards to how we should be dealing with this shit. Like,
I think for people who are against the vaccine, I guess speak to someone, speak to someone working in the hospital, speak to someone that's, you know, dealing with it. Speak to people who have had it or have had to go into hospital. Be selective with the sources of information that you use. Don't just go off, I guess I just told you to speak to people, but don't go off the information of, you know, just anybody.
Don't go off Facebook.
Exactly. Don't go off Facebook. Don't just go off headlines.
Yeah.
You know, look at government websites, look at studies, journal articles, look at what they're saying. And, you know, it requires, I guess it does require a background level of education to be able to analyze a study. So I'm not going to say that's something that everyone should and can do.
I'll be honest, man, I spent a lot of time initially just doing 2 seconds of background on spurious articles people were forwarding me, you know, that they found on Facey, basically validating their opinion. You know,
and don't go, so keep an open mind. And, you know, everyone that says, it's funny that I say keep an open mind because everyone that I've heard from who's been against the vaccine, so they're the ones who are usually saying keep an open mind. They're usually the closest. They have they're usually the closed-minded ones because they're not open to looking at other sources of information. No. They are selective with the information because and the resources that they use.
All they do, man, is they find, and it's
selection bias.
It's not even just COVID. It's everything. Flat earthers. It's every conspiracy under the sun. They just find something that validates their opinion and then they latch onto it.
Exactly. And they don't look at the other side.
Man, like I said, I debunked so many articles like, oh yeah, who was this written by? Cool. Do a search on the guy that was written by. Some nut that was like kicked out of medical school.
And went to jail.
Yeah. Spent 10 years. Oh, he's fighting the system. No, he's not. Like, he's a nut. Like, 2 people died under his watch. Like, are you serious?
Yeah.
You know what I mean?
The thing is, you can poke holes at anything as well.
Yeah.
But, just try to look at objective sources of evidence is the best way to
Can
put
I ask
about
you,
it.
man, like, I sort of touched on this before, and you're very diplomatic, and I understand why. But how does it make you feel, man, knowing that there are people actively going out there every day believing that you're getting up to literally hurt people? You know what I mean? To work against the goodwill of society. As a doctor, man, and I take it back to the Hippocratic Oath. I always do.
Yeah.
You know, because it's literally the benchmark. It's like, dude, like that's why I do respect anyone working in medicine. You know, because it's like you're a different caliber, man. You got up in the morning with a different mindset to everyone else.
No, you keep in mind that not everyone can have the understanding that you have of how the health system works, how the human physiology and pharmacology works, and how the hospital works, how patients respond to treatment, and so on. And you know, not everyone understands the outcome of certain treatments and so on again. So that's what I just try to keep in mind whenever I'm in a difficult situation where potentially a family member may not be agreeing with what we say or.
Yeah.
But, you know, you always ask what their opinion is and what they would recommend. And, you know, if it's plausible, you keep it in mind. And
I had a relative end up in ICU, you know, like not that long ago. And they said to me, you know, how did this, like, you know, whoever thought I would have ended up like this? And I'm like, I said, not only have you ignored every sign that you had along the way, you ignored every fucking doctor on the way as well.
Yeah.
Okay, and what's going to change now? Okay.
Prevention's better than a cure.
Yeah. Okay, and and moving forward, what are you going to do differently? Okay, even if you weren't in the situation you're in, you know what I mean?
Well, yeah, usually when you get to the point where you develop a health problem,
Yeah.
in most cases that's usually too late because
Yeah.
you've already, the best way to think about it is you've already started doing damage to your body that's irreversible.
Yeah.
And I guess there are people out there who do so much damage that they're just like, well, fuck it. I'm not going to listen to anyone anyway. And, I empathize with them. If you get to the point where you've done irreversible damage to your health and, your quality of life isn't going to be that good anyway, then, like, I don't recommend that you just keep drinking and smoking and doing drugs, but you're a bit like, well,
I
get where you're coming from, and I understand that I'm not going to change your mind, but this is what I recommend if you want to live longer.
Yeah. Fucking heavy, man. Look, I honestly, like, I appreciate you coming down, man, because I know it's been chaos trying to get you here just because of your rotating sort of shifts.
Yeah.
What kind of hours are you actually working?
Oh, mate, well, look, I'm working like 6 days a week.
Yeah.
Usually anywhere between, I guess 8 hours on a good day, 12 hours on a bad day.
Yeah. Is it rotating hours as well? Like,
yeah. So right now I'm actually I've had exams and stuff going on, so it's been a bit hectic in that regard, but I'm actually on a rotation at the moment that has the hours are quite good.
Yeah.
But normally I am on rotating hours. So night shifts, day shifts, evening shifts, weekends.
Yeah.
A rotating roster. At the moment, I'm not on a rotating roster, and I think that's what I was trying to let you know. I'm like, oh no, everything's going to look good from here on.
Yeah.
And the COVID situation has, particularly where I'm working, the COVID situation has gotten a little bit better.
Yeah.
And that's definitely helped as well.
Man, all I can say is I tip my hat to you because, like I said, forget the fact that I've no way near have got the discipline to actually do what you do or the ability. If I was in your situation, man, I'd be a loose fucking cannon. You seem so, you're like the calmest person I've ever brought into this room. I'm telling you, just taking on what you're saying, I'm starting to get anxiety, like anger.
Yeah.
And I'd walk around with a chip on my shoulder every fucking day. I already do. And I'm not a doctor. You know what I mean? Yeah. All I can say is thanks for like coming down, man.
Thanks for having me on, man.
Really, you understand, man. Like, no one's going to listen to me. I try and get an educated opinion on as much as I can, but I'm pissed off that I couldn't actually get you in earlier. You know what I mean? Just to try and change the message going out. Yeah. I'm not a corporate shill. I'm not I don't wear blinders, but I know when the writing's on the wall, man, and like you said, the message has been sort of, it's gone back and forth, and people have had that hesitancy, especially with vaccines and stuff, But like I said, it's good marketing, man. If you can push Married at First Sight for the last how many years, surely you can push something that's like this, beneficial to everyone else.
No, I agreed.
Oh, fuck me. I'm sorry, man. Dude,
That's all good.
I just want to say thanks,
No
man.
worries, mate. Thank you.
Hold up.